As the Delta State Governor, Right Honorable Sheriff Oborevwori, marks 1 year in office, his more agenda has come into focus. This special report takes a look at the remarkable feats of the governor in providing more access to affordable and quality health care for Deltans through the Delta State Contributory Health Commission.
Across the globe, health insurance has been known to act as a financial buffer against unplanned, unpredictable, and out-of-pocket medical costs that could otherwise deplete one's emergency fund and savings. Hence, the establishment of the Delta State Contributory Health Scheme to ensure access to affordable and quality healthcare services for all residents of Delta State, irrespective of their socio-economic status and geographical location. The Delta State Governor, Right Honorable Sheriff Oborevwori, in line with his more agenda to bring more dividends of democracy to Deltans, especially in the health sector, swung into action upon assumption of office on May 29, 2023, and appointed two experienced result-oriented achievers, Dr. Austin Obidi as chairman of the Delta State Contributory Health Commission, and Dr. Isaac Akpoveta as Director General and Chief Executive Officer, with a mandate to effectively implement, regulate, and supervise the Commission so that affordable and quality healthcare would be a reality. Understanding the assignment and poised for excellent delivery, the duo, after their screening and subsequent swearing-in on the 25th of September 2023, hit the ground running by constituting the governing board of the Commission, comprising experienced professionals from key entities, including the Ministries of Health and Economic Planning, the Office of the State Head of Service, the Nigerian Labour Congress NLC, Trade Union Congress TUC, the Civil Society Organization CSO, Nigeria Employers Consultative Association NECA, and the National Health Insurance Health Commission.
The present governor being a system person who actually have been very interested in health insurance even before he became governor. When he was the speaker, they were the one that passed the bill into law to start with. And I knew he attended a lot of insurance conferences across the nation before he became governor. And so he realized, I think so, that there is need for continuity, sustainability of the health sector, of the health insurance. And I was pleasantly surprised and happy that he appointed me the Director General. I said to Dr. Akpoveta, go and do what you know best to do and ensure that that place is stable and grow in bonds. And today, I can tell you, I left and met an relief figure of about 1.7. Today we have 2.2 million plus, going to 2.3, 2.4 million enrollees in the last 6 months I took over. And what did I do differently? I realized after thorough assessment of my performance in the first 7 years, I reassessed myself, I assessed the commission, and I realized that popularity of the commission is low. The people are not very aware of the commission.
Today, among other remarkable achievements, the Commission has enrolled over 2 million residents of the state in the Contributory Health Scheme, with emphasis on the indigent and vulnerable members of the society. This has placed Delta State as a front-runner and reference point amongst all states in Nigeria, thanks to the proactive and ever-supportive Governor, Right Honorable Sheriff Oborevwori. As a former lawmaker, the Governor understood the provisions of the Delta State Contributory Health Scheme Law of 2019, which recognizes the vulnerable as pregnant women, children under 5, the elderly over 65 years of age, the physically and mentally challenged, the less privileged, and others. Hence, he consistently provided funds to service their medical expenses in the health facilities of their choice through the equity plan of the Health Commission. Dr. Isaac Akpoveta speaks more on the equity and other health plans of the Commission.
To ensure that the people are aware of health insurance and the value of health insurance to everyone. And of course, I started some new initiatives. Apart from the one we were operating before, I started the Indigent Enrollee Adoption Initiative, the Artisan Enrollee Inducement Initiative, the TSHIP, Tertiary Institution Social Health Insurance Scheme for students, and among others. And in particular, the Indigent Enrollee Adoption Program has gained ground, because in that I made a clarion call to Deltans of goodwill, Deltans of note, philanthropists in the society, to come to the aid of the poor, aid of the vulnerable, the indigent people. Every one of us have a poor man in our home. In Africa, if you have one rich man, then you know that 90% of the family is below par. And then we need to go home and help our people. And I'm glad that a lot of prominent Deltans have heed that call, and they have been adopting and paying health insurance for our people. May God bless them. And so that is one of the major things. Again, I also ensure that the system here is working very well, probably improved on the smooth running of the scheme. Ensure that whatever little money we have, we pay the providers. Also talk to the providers, healthcare facilities, to ensure that they good attention, good service to our enrollees.
To give life to the plans of the mandate that we're given. Number one, we need to increase coverage. That is to say, the enrollees, we must increase it. We set a very big target for ourselves. 1 million enrollees within the first 1 year. That's a big one, but we're working on it. But it would be nice to put on record that we're the first and the leading health insurance body nationwide.
Recognizing that most residents of Delta State are either self-employed or not employed by the government and thus fall under the informal health plan, and driven by a commitment to achieve Sustainable Development Goal 3, universal health coverage for all, various initiatives have been introduced to ensure no Deltan is left behind. One of such initiatives is the Indigent Enrollee Adoption Initiative, which provides opportunity for philanthropists, companies, and organizations to adopt and pay the premiums for a year for the indigents in their localities with just 7,000 naira per person. Since its launch, the initiative has seen over 1,000 indigent Deltans registered, as well-meaning Deltans have embraced the initiative. In Okpe local government area, Mr. Midian Obayamo adopted and purchased health insurance for 100 indigents of Jedo community, thereby improving the health indices there. Oshimle North local government followed suit, with a member representing the area in the State House of Assembly, Honorable Frank Esenwa, purchasing for 200 persons. In Anyocha North local government, the Organishu Mwobekenu Foundation adopted and paid for 100 persons in their community. The Urobo Nation also saw their illustrious sons, Honorable John Nani, the chairman of the Delta State Oil Producing Areas Development Commission, the SOPADEC, adopting and purchasing health insurance for 240 women, and Honorable Solomon Irapata, the chairman of the Delta State Board of Internal Revenue, sponsoring 250 women. All the beneficiaries were drawn from the various clans that made up Urobo Nation.
I've been told that other ethnic nationality in Delta State getting the cards, the health insurance scheme. And I know full well that we have vulnerable persons who cannot get this card. So I decided to give for the first phase 10 per each kingdom of the 24 kingdoms in Urobo land. And the 24 kingdom 10 will give you 240. That's what I just did. As time goes on and God helping me, I will do more. And I'm also asking those women in Urobo, women and men, to also contribute to the indigent old women who cannot go to the hospital because of finance.
It's a thing of joy because, like I did say during my speech, that a healthy nation is a wealthy nation. And in line with His Excellency's dream for Delta State, it is more agenda. He promised Deltans that he's going to do more for them. Meaningful development, opportunities for all, enhanced peace and security, and of course, meaningful development. So, in line with that, you can see that there are opportunities for virtually everybody. And what I'm seeing today, it's my own way of complementing what His Excellency is doing, because government cannot do it all. So I need to also show love too to my people. And this is just the beginning. By the special grace of God, I'm still going to do more in line with His Excellency's more requests for Deltas.
Moved with compassion are the unique challenges faced by persons with disabilities, and a reaffirmation of his commitment to advocating the rights and dignity of people living with disabilities. Dr. Isaac Akpoveta adopted and paid health insurance premium for 250 persons living with disability, with beneficiaries comprising 10 persons from each of the 25 local government areas of the state.
Who have graced us with your presence today. See, when a man with disability traveled all the way from Mugeli, from Agbo, from Bomadi, it must be a man with a lot of courage. And so I appreciate your coming to see us here today. We must ensure that you are included in the activities. And I'm happy, yes. And I'm happy His Excellency, the former governor and the present governor, like you've just rightly said, is already doing that. I'm not surprised because they are men of goodwill.
Catching the vision and in support of their DG, directors in the Delta State Contributory Health Commission have keyed into the initiative, with some adopting 10 persons with disabilities and others 5.
I love the way they paid attention to us and they served us, and the CS, the way they told us that it's free. I have confirmed it that it's free, that nothing is to be paid. And from the other places I've been, like my first daughter I had by CS, I paid 300,000 at the end of the day after buying so many drugs that I bought in order for them to carry out the services. But here, I've seen something different, and I want to thank the government for this wonderful scheme they've provided for us.
The state government has graciously been very supportive of the Delta State Contributory Health Commission, which has been in existence for some years now, and thank God that the present governor has continued with the legacy of the previous government. And I want to say that so far it's been a good experience because we've been able to meet the health need, most of the health needs of most of the people in Delta State, a large number of people in Delta State, because we know that healthcare is not cheap, especially with the current economic downturn. A lot of people cannot really afford healthcare. So, for instance, you see a pregnant woman who cannot even eat 3 square meals. You tell her to come and pay 300,000 for CS. She really cannot afford that, but with the help of the state government, Asaba Specialist Hospital has been able to offer free maternal care to her patients. In fact, our delivery rate is about 180 per month, and we do about 60 to 7 cesarean sections every month, free of charge. And a lot of indigent people have actually benefited from this, and it has gone a long way to reduce the death among pregnant women and their children too. So I would say that the state government has indeed done very well, because with the scheme and the support, the drugs and all of the things that go with it, as a hospital, we've been able to offer care to our patients as at when they need it, and without them having to worry about the financial aspect of the care that they require. So I want to thank the state government and say we hope that this continues, and the Deltans will definitely be very happy with it if it's something that goes on beyond, as in beyond now. Yeah.
I was referred here by my friend who gave birth. She said everything is right. At first I did not believe. I said, how possibly it is? So I said, let me just come and try with antenatal. So the first antenatal I came, it was free, registration, everything. Seeing doctors and drugs was free. So I continued till my delivery with CX. And after everything, I did not pay any money. So I'm so happy for the free offer. I'm happy for the governor, what he had done for us. I really appreciate his effort. It's not easy.
For the treatment, I will just write it on my claim form. I will now go and collect it from the pharmacy. I will not pay. But the one they don't have, they will not write it for me to go outside and buy it. Yes, I'm enjoying it since one of my children. They're getting to 3 years. I'm enjoying the doctors, all of them they are trying, the nurses, all of them they are trying, enjoying their service. That's why I like the hospital, it's the best. And thanks to governor, he's trying for us, he's trying.
The enrolled is meeting their challenge, particularly the children, the pregnant women, and in fact entirely the family. For the patients, it's been doing well. Though we know there is need for improvement, particularly on the area of the coverage. We look forward for it, for more people to come on board. So far for the patients, it's been wonderful. And they have testimony. And because globally, health insurance don't cover everything. So even in the Western world, it's not everything they cover. So for the ones that is covered by this scheme, so far the patients have good testimonies and they are happy.
Yeah, they are doing really well, because even when I get back to my daughter via CS, yes, we didn't get to pay. It was something very helpful for us. It was during that cashless policy last year. So, and you know how things were now, things were really funny then. So it was through the help of this insurance card that we were able to sort things out. The load was not heavy on us. So,
apart from the Indigent Enrollee Adoption Initiative, there is also the Artisan Enrollee Inducement Initiative, designed for craftsmen and skilled workers. They also initiated the Tertiary Institution Social Health Insurance Program (TSHIP), aimed at ensuring quality and affordable access to healthcare to students in tertiary institutions in the state. With approximately 8,000 students from the Denis Osadebe University DOU and the University of Delta Abo already registered, and more underway, a significant milestone in healthcare accessibility for students in Delta State has been achieved.
We have this tertiary institution social health insurance program. I'm sure the airwaves have been carrying it. Went to Denis Osadebe University. We're enrolling the students, because a healthy mind is the mind that can do well in school. We've been to UniDel, University of Delta at Abo. Discussions are on with all the other tertiary institutions like Delsu Abraka, the School of Health Technology, Colleges of Nursing Sciences, and the likes.
We have the TSHIP. The TSHIP is Teacher Institution Social Health Insurance, Student Social Health Insurance program. That had been, is actually a program initiated by National Health Insurance Authority many years back, but it's hardly worked in most states. Even the federal government couldn't drive it in universities, federal universities. But in Delta, we did a rethink and design of that program. And with that, we're able to convince the universities, and they are enrolling MATs into the scheme at the moment. You saw the flag off we did at there's a university where about 4,000 students were enrolled, and then University of Delta, Unidair at Agbon, where more than 8,000 have been enrolled. And other universities are coming and polytechnics. And the reason they are now interested is the redesign. One, the student will receive care from their clinic in the university, which we will ensure that is very standard. Of course, we're going to pay capitation to them, and that capitation, part of it we use in upgrading the health facility in the university to a level that the student will be happy to attend there, because sometimes the environment of a hospital discourages people from attending. So that is number one, redesign. Second part of it is that the student on holidays can receive care anywhere in the state. With the ID card, they walk to any hospital, government or private, registered in the scheme, we will pick up the bill for them. So on holidays, in campus, outside campus, in the state, they will get care. We also went further. We've discussed with our colleagues in other states to ensure that those students who are in Delta pay their insurance premium in Delta, but they live in Lagos during holidays. They will also be able to attend a hospital registered in Lagos State Health Insurance scheme, and then the bill is sent to us to pay. So we made it very robust for the student, that anywhere the student is in Nigeria, it will be taken care of. And this really encouraged the student unions, the university authorities, and it was an automatic success.
To ensure the enrollees start accessing care immediately after they are registered, the Director General moves with his officials and registration equipment to enroll residents into the scheme and presents them with their health insurance cards on the spot. In all of this, the hard-to-reach areas in Delta State, especially those in the riverine communities, were put into consideration. Hence, the Access to Finance program, a public-private medical partnership which has been running since the inception of the Commission, was sustained. The arrangement, which allows private sector organizations to upgrade, manage and run health facilities in hard-to-reach and underserved communities, has helped provide more access points to healthcare and spread good health in those areas. The success story of the Delta State Contributory Health Commission has attracted different categories of persons and groups to the Commission, including the Odiolobo of Oyede Kingdom, His Royal Majesty, Dr. Idiare J.I. and some palace chiefs, the Association of Resident Doctors Federal Medical Center, Asaba, the Nigerian Medical Association, NMA, Delta State Chapter, as well as proprietors of community newspapers. They all showered encomium. Even when the Delta State House of Assembly Committee on Health visited the Commission as part of its oversight functions, the leader of the delegation and chairman of the committee, Honorable Ferguson Onwo, said the committee was satisfied with the robust operational framework and structure of the departments in the Commission and promised to address whatever challenge the Commission may be grappling with.
Basically, I want to begin by saying you're welcome. You're welcome, and I hope that this coming will be the beginning of very great partnership between the legislature and this small part of the executive. Thank you and God bless you.
If you want to register 1,000, for example, it's about 7 million, the bank will give you the loan. You pay over time to the bank, and meanwhile, you participate in care in their way home.
So when I said I'm excited here, because what I've seen here, you are doing a great job here. And I've learned something here. I don't know whether my members already noticed it. I don't know whether the reason why you're associated is that you are gender friendly, because I see most of the staff are women. You see what I did here to show that I'm really interested. I ensured that my vice enrolled immediately. I also ensured that my lost ID card I was able to retrieve it. I did that to show you that we in the committee, we have decided that I will stand by you. I told my committee members and some other members that this program is the cheapest I have seen. But there's no doctor that are going to consult even without treatment that are going to pay 7,000. It's not possible. So if you are even getting that for that consultation before, because most of the things, the drugs are not available, yes, but they have been able to know the reason why you are sick. You are sick for some reason. This is your problem. So with that, we are convinced that the program should be on course. And in doing that, I encourage my members that when we leave here, we sit and look at the challenges which we discussed openly and the one we have discussed behind. So I was still going to discuss behind. Because this is a program that must not fail. If it is true that you are leading in the country in this program, others are following, we must ensure that you remain at the top. So that we can partner with us. We pride ourselves as the most vibrant house of assembly in this country, for which nobody has questioned us. So if we're in the House Committee, I also lead this to have made something together. As president, I've met at a particular point. And I also members that will stand by you at all times.
Little wonder, the Federal University of Petroleum Resources, EFRUN Center for Sustainable Development, decorated the Chairman Governing Board, Dr. Austin Obidi, and the Director General and Chief Executive Officer, Dr. Isaac Aboveta, as SDG Champion and Fellow respectively, and gave them awards in recognition of their commendable contributions towards the actualization of SDG 3, which is to ensure healthy lives and promote well-being for all at all ages. They had this to say.
Contributory health scheme is the major funder of health in the state, and a lot of deleterious effects of climate change and, do we say, environmental degradation, they impact on the health of the people. Prevention, they say, is better than cure. Then beyond that, if you are healthy, there is something we as doctors call promotional health. You know, you are well, you want to stay well. So Contributory Health Commission partnering in a way is part of pushing and propelling the more agenda of Right Honorable Sheriff Oborevwori Francis, our amiable governor. Thank you.
On SDG sustainable development of the society, Delta is very much aware, apart from other activities through environmental protection and so on health. The SDG 3 is very paramount. It's about you and me and how to curtail the effect of environmental damage on us, and Delta State is forefront. We are doing that. We have got so many initiatives to ensure that we have the indigent enrollee adoption initiative, where we appeal to people like you who have some more money to buy insurance for your neighbor who cannot afford it himself or herself, at just 7,000 naira per year. And I can assure you a lot of people are buying insurance for their people. That we have gotten this so far means that there have been a strong political will. Political will is not something you can grab and see, but you see the effect. That regularly we get people enrolled in, we got funds to pay for services rendered, we have funds to run the system here, mean that fund is being released to us. And it's only a political willed system that releases funds to an agency. And so that is there. And I wasn't surprised, and I'm not surprised, because the present governor, Right Honorable Sheriff Oborevwori, was the speaker, was a member of House of Assembly when this law was passed. And he has been defending and supporting the system even before he became a governor. When he was a speaker, he did a lot to support us. So I wasn't surprised that when he took over, the goodwill of the former governor, Senator Ifeanyi Okowa, continued. And I will tell you one of the signs of goodwill, political goodwill and force. Reappointing my honorable self from the chairman to go and come and sustain the system, it's a sign that you want the system to survive. Instead of bringing a brand new person, say, no, Dr. Povita, come and stabilize the place, come and sustain the place. And so that is very important. It's a sign that he's determined to ensure that this place works. And since I came in, I've been very supportive, financially, politically, advice-wise. And so I must thank His Excellency the Governor for his effort to ensure that Deltans, you know, the more agenda is very clear. He wants to do more. Symbolically represented, want to do more for Deltans. And what is more than good health for people? So Sheriff cares. He cares for Deltans. He wants to ensure that Deltans get good health and quality health care in the system. So there is a lot of political goodwill from the government.
Dr. Akpoveta and Dr. Obidi, despite these achievements, said more will continue to unfold under Governor Oborowori's leadership, as the Commission is determined to break all barriers and create a more inclusive healthcare system that caters to the diverse needs of the population. According to Warren Bennis, an eminent scholar and author, leadership is the capacity to translate a vision into reality. As Right Honorable Sheriff Oborowori marks 1 year in office as Governor of Delta State, it is evident for all to see how he has proven himself a true leader by bringing into reality his vision of providing more health care for Deltans.
And 85 and 30 men of grace were initiated by this administration. Few days from now, we shall commence the commissioning of some of these roads and other projects in other sectors for the world to see what we have accomplished in 1 year by the grace of God. I will conclude my remarks by saying that the past 1 year has been one of trials and triumphs, tests and testimonies, and adversity and good. Through it all, God has been faithful.
Indeed, putting square pegs in square holes makes the job easy. The more agenda is working and the residents of Delta State are happy. Expect more quality and affordable health care under the leadership of Governor Sheriff Oborowori. Congratulations, our dear Governor.